Welcome to this week's update around the coronavirus pandemic in Devon. We're starting to see numbers fall now, which is good news. However, the numbers are still more or less the same as they were at the beginning of December, and we're still not seeing a reduction in the number of people who are unfortunately dying with COVID-19. I'd like to hand over now to my colleague Simon Chant, who will talk you through the data in more detail.
This is an overview of the latest national and local data on COVID-19 as of Thursday, the 4th of February. We start with the national picture. Cases are falling nationally. The number of tests remains high due to increased local testing capacity. Deaths remain high, but numbers may have started to stabilise. Now for the local picture. In Devon, for the latest available week, there are 639 COVID-19 cases and 53 deaths, with rates of both below the national average. Case rates are slightly higher in mid-Devon. Cases of COVID-19 are continuing to fall in Devon, although cases and deaths are still above the levels seen in November and December. Case rates are currently highest for those aged 20 to 39, but are falling in all age groups. The data in this summary is drawn from Devon's COVID-19 dashboard and a national coronavirus tracker, where the latest available information can be found.
Thanks, Simon. While it's good to see cases are falling, we are still seeing some outbreaks in workplaces. And often this relates to people car sharing, people sharing cars to and from work from people who they do not live with. So I urge people to try and avoid this if at all possible. If it's essential that you car share, then you can do some things to minimise your risks, such as wear face coverings and opening the windows. This week, we've seen the opening of our first of 13 community testing centres across Devon. The first site in County Hall started this week, and it's specifically for people who have no symptoms and who are key workers who can't work at home. We know that 1 in 3 people who have coronavirus don't have any symptoms at all. And while some people are involved in regular testing programs in their workplaces, this is for people who aren't involved in any testing program at all. We recommend people come twice a week to get tested to see whether they are infectious with the coronavirus, and if so, they can then isolate. To book a test, go to devon.cc/testing. I continue to urge people to follow the national lockdown rules. Stay at home unless it's essential you go out. And if you do have to go out, please continue to observe those social distancing rules, wear those face coverings, and wash your hands regularly. Now I'd like to hand over to Dr. Paul Johnson, CCG.
Cases in the community are stabilising, and that's also reflected in the number of people in hospital with coronavirus. This is good news, but however, we can't get complacent. So please continue to maintain your social distancing, to wash your hands regularly and wear a mask in public, even if you've had a vaccine, which more than 200,000 of you have. It's fantastic news. Every time someone is vaccinated, it reduces the risk of people dying or becoming seriously ill and brings us a small step closer to the end of the pandemic. We're on course to have offered a first vaccine dose to everyone in the top 4 priority groups by mid-February. Appointments for second doses will be sent to you to ensure that you get your second dose within 12 weeks of the first, in accordance with national guidance. So you don't need to contact the NHS, because you will be invited for your vaccine when it's your turn. And please don't just turn up because you need your invite to get your vaccine. There's 6 main ways that the vaccine is being delivered to local people in the eligible groups. Firstly, all 4 of the country's main hospitals. Secondly, we have 20 GP-led sites which serve all of our GP practices in Devon. 2 large vaccination centres in West Point, Exeter and Home Park in Plymouth. There are 3 community pharmacies in Plymouth, Exmouth and Westwood Ho, with more to follow. And care home residents and staff and people who are housebound are being vaccinated by GP-led facilities, and mobile teams are bringing vaccination facilities closer to people in rural areas. There's 2 main ways people will be contacted about getting the vaccine: by your GP practice to be vaccinated at your local GP centre, or a letter from the National Booking System to book an appointment at a large-scale vaccination site or a community pharmacy, where you can book online or by phone. You can Ignore the national letter if you would prefer to be vaccinated at your GP centre, and vice versa. The majority of care home residents have been vaccinated, and we're aiming to vaccinate those remaining as soon as we can. Arrangements vary at the Devon's major hospitals, but if you are eligible, you will be contacted directly by them. Each GP practice is working through their patient lists in priority order as quickly and as safely as possible. And as they started in phases, they are working at slightly different paces and will contact everyone in turn. Importantly, if you're not registered with the GP practice, please do so as soon as you can to ensure you're invited for your vaccination when it's your turn. And remember, even if you've had the vaccine, it's important to continue to follow the social distancing guidelines, as immunity takes a few weeks to develop. So please stay home, follow the rules to stop the spread of coronavirus, and get your vaccine when you get invited.